Hi, my name is Beatrice Melin. I'm a professor of oncology at Umeå University, Sweden. I will talk today about blood tests for detecting cancer early, which is a project we have together with the regional cancer centers in Sweden. As you might know, if we can find a tumor when it's early stage, it really increases the possibility of survival. And we need innovative and easy to use methods for early detection. When viewing the survival of colorectal cancer, you could see here by the stage that if you have a stage 1 or a stage 2, you're very much better off in terms of the chance of surviving. So in that sense, with a blood sample, if we can do a shift, that could make a big difference. Then, of course, you could wonder, when in life should you do that type of test? And I would say very early on, it's rare that we test, but from adulthood, you go to different types of general health checkups, or colorectal cancer screening, breast cancer screening, and then you could add a test to that moment when you're anyhow having a contact with your health professionals. And in that sense, define different type of high-risk groups and detect cancer earlier. Then you could wonder, when should you actually do this test? For what reason? How could you intervene? One thing is, of course, that you maybe define that you have a higher risk and you can do some kind of lifestyle change. You could do pharmacoprevention, or you could do it at the same time as you do screening. If you have certain symptoms, you might take the blood test then. What do you need to know about a new blood test for cancer? I would say that all types of tests needs to be doing a discovery, a test, and then a validation, and different types of clinical studies. You need high quality samples to get high sensitivity and high specificity. You don't want a lot of false positives with a signal that really isn't a cancer. And all of this, we need to know a lot about a test before you can actually put it into a clinical study and to the clinic. And therefore, in Västerbotten County in Sweden, we've done health checkups at 40, 50, and 60, all the way since 1990. And now we've done a lot of research in these samples already, but now we've done a new informed consent, and we call that the PREDICT study. That gives us the opportunity of doing discovery, validation, and clinical tests in our population. So that's very exciting, and we're looking forward to more research in this area. And of course, you could wonder, what could you actually see in a blood test? And I would say it's a lot. You could find genetics. There's now platforms with thousands of proteins, metabolites, and quite newly, methylation tests, which actually could guide you where the tumor comes from, like a multi-cancer test. With that, I would like to summarize that blood tests for detecting cancer is really a developing field, both because we have new discovery platforms, we have new types of tests in clinical trials, and it's really worthwhile because if we can detect cancer earlier, that could alleviate the patients to have less treatment and better quality of life. Thank you.